This is Comprehensive Virology Audiobook. Please shut your eye and listen. The general feature, viral structure, refers to the basic physical organization of a virus. Despite their diversity, most viruses share some common structural features. 1. Every virus have nucleic acid core. Viruses carry their genetic material as either DNA or RNA, but never both. This fucking nucleic acid can be single-stranded or double-stranded, and it carries the instructions for making new viruses. 2. Every virus also have capsid. This shit is a protein shell that surrounds and protects the viral genetic material. It is made up of smaller protein subunits called capsomeres. The capsid can also help the freaking virus to attach to host cells. 3. The other viral structure is envelope, which is optional. In such a way, some viruses have a lipid membrane envelope surrounding the capsid. This envelope is usually derived from the host cell's membrane during viral replication. Some of known enveloped viruses include influenza virus, HIV, and herpes viruses. 4. Surface proteins or spikes. These shits are proteins or glycoproteins that stick out from the capsid or envelope. They are crucial for recognizing and binding to host cells. For example, the spike protein of coronaviruses. 5. The shapes of viruses. Virus may have helical shape, which is rod-shaped, like the tobacco mosaic virus, or they may have icosahedral, which is spherical appearance with 20 triangular faces, like a fucking adenovirus. Some may have complex shape, more complicated structures, like bacteriophages. These motherfuckers infect bacteria. Viral genetics terms. Recombination. Recombination is the exchange of genes between two chromosomes through crossing over, within regions of significant base sequence similarity. This process allows genetic material to be shuffled, resulting in new fucking viral genomes. Reassortment. This one occurs when viruses with segmented genomes, such as the influenza virus, exchange genetic segments. For example, the 2009 H1N1 influenza pandemic resulted from a complex reassortment of genes from human, swine, and avian influenza viruses. This process can cause antigenic shift, which may lead to pandemics. Remember, reassortment means mixing segments between different viral strains. The other term is complementation, which happens when one of two viruses infecting the same cell has a mutation that causes a non-functional protein, then the other virus, which does not have this mutation, compensates by producing a functional version of that protein. An example for this is the hepatitis D virus, or HDV. It relies on hepatitis B virus, or HBV, to provide hepatitis B surface antigen. This protein is necessary for HDV to assemble and infect other cells. Phenotypic mixing. This phenomenon occurs when a cell is infected by two different viruses at the same time, and in the progeny viruses, the genome of virus A may be coated with the surface proteins of virus B, forming what's called a pseudovirion. This hybrid virus will have the infectivity pattern, or tropism, of virus B due to its outer proteins. However, future generations will return to virus A's original protein coat, because the genome is still from virus A. Viral genomes. Naked nucleic acids from most double-stranded DNA viruses are infectious, except for pox viruses and hepatitis B virus, and the naked nucleic acids from positive-sense single-stranded RNA viruses are also infectious. In contrast, negative-sense single-stranded RNA viruses and double-stranded RNA viruses are not infectious on their own. This is because they lack the necessary polymerases needed for replication. However, the virions of negative-sense RNA viruses carry RNA-dependent RNA polymerase to convert their genome into a positive strand for transcription, so they are infectious. Let's see the characteristics of DNA viruses. All DNA viruses have double-stranded DNA genomes, just like human cells, except for parvovirity, which has a single-stranded DNA genome. Most DNA viruses have linear DNA, but three families are exceptions. These are papillomaviruses, polyomaviruses, and hepatinoviruses. They have circular DNA. Characteristics of RNA viruses. All RNA viruses have single-stranded RNA genomes, except for reovirity, which has double-stranded RNA. The positive-sense RNA viruses act like messenger RNA. These include retroviruses, togaviruses, flaviviruses, coronaviruses, hepaviruses, caliciviruses, and picornaviruses, while the negative sense RNA viruses include arenaviruses, bunyaviruses, paramyxoviruses, orthomyxoviruses, filoviruses, and rhabdoviruses. Some RNA viruses have segmented genomes. These include bunyaviruses, orthomyxoviruses, arenaviruses, and rheoviruses. Here is helpful mnemonics. To remember the positive sense RNA viruses, while at a retro toga party, I drank flavored Corona and ate hippie California pickles. This helps you remember retrovirus, togavirus, flavivirus, coronavirus, hepavirus, calicivirus, and picornavirus. Viral envelopes. In general, enveloped viruses get their envelopes from the plasma membrane as they exit the host cell. However, there are exceptions, example, herpes viruses which acquire their envelopes from the nuclear membrane. Some examples of the enveloped DNA viruses are herpes virus, hepanovirus, and pox virus. You can remember this with the phrase, enveloped DNA viruses have helpful protection. DNA viruses. All DNA viruses are icosahedral in shape and replicate inside the nucleus, except for the pox virus. Remember, pox is out of the box, meaning it replicates outside the nucleus. Here is a short summary of DNA virus families. Attention please. Herpes viruses are enveloped, double-stranded and have linear DNA, will be discussed shortly. Pox virus are enveloped with double-stranded and linear DNA. It is the largest DNA virus. These motherfuckers are known to cause smallpox, which has been eradicated worldwide through the use of a live-attenuated vaccine. Another group cowpox causes, milkmaid blisters, molluscum contagiosum causes, flesh-colored papules with central umbilication, keratinocytes contain molluscum bodies. Hepanovirus are enveloped, partially double-stranded and circular DNA. These bastard with hepatitis B virus, HBV, causes acute or chronic hepatitis. Although it is not a retrovirus, it uses reverse transcriptase. Adenovirus are non-enveloped, double-stranded and with linear DNA, known to cause febrile pharyngitis, which presents as a sore throat, acute hemorrhagic cystitis, pneumonia, conjunctivitis, commonly known as pink eye, also cause gastroenteritis and myocarditis. Papillomavirus. These fucking viruses are non-enveloped, with double-stranded and circular DNA. Human papillomavirus, HPV, causes warts and cancers. HPV types 1, 2, 6, and 11 are associated with warts, while HPV types 16 and 18 are associated with cancers, such as cervical, anal, penile, and oropharyngeal cancer. Polyomavirus. These are non-enveloped, double-stranded and circular DNA. One type of this called JC virus causes progressive multifocal leukoencephalopathy, or PML, in immunocompromised patients, such as those with HIV. Another type BK virus commonly affects kidney transplant patients. Remember, JC4, junkie cerebrum, and BK4, bad kidney. Parvovirus are non-enveloped, have single-stranded and linear DNA. It is the smallest DNA virus. Parvovirus B19 causes aplastic crises in patients with sickle cell disease. It causes a slapped cheek rash in children, also known as erythema infectiosum or fifth disease. It infects red blood cell precursors and endothelial cells, leading to red blood cell destruction, hydrops fetalis, and death in the fetus. In adults, it can cause pure red blood cell aplasia, and symptoms resembling rheumatoid arthritis. Isn't that entertaining? Herpes viruses are enveloped, double-stranded, linear DNA viruses. Recent studies show that HSV-1 and HSV-2 can affect both genital and extragenital areas. Here's a breakdown of important herpes viruses. Listen carefully, fellas. Herpes simplex virus type 1, HSV-1, the route of transmission is respiratory secretions and saliva, causes gingivostomatitis, keratoconjunctivitis, herpes labialis, also called cold sores, herpetic whitlow on the finger, temporal lobe encephalitis, esophagitis, and erythema multiforme. HSV-1 is now responsible for an increasing number of genital herpes cases. You know why? Latency, most commonly latent in the trigeminal ganglia. Notes: HSV-1 is the most common cause of sporadic encephalitis. Symptoms can include altered mental status, seizures, and aphasia. Herpes simplex virus type 2, HSV-2, the route of transmission, sexual contact and perinatal transmission, causes herpes genitalis and neonatal herpes, latency, obviously most commonly latent in the sacral ganglia. Notes: viral meningitis is more common with HSV-2 than HSV-1. Varicella zoster virus, also known as human herpes virus 3, or HHV-3, the route of transmission is respiratory secretions and contact with vesical fluid. This virus causes varicella, also known as chickenpox, and shingles, also called herpes zoster, can also cause encephalitis and pneumonia. Notes: the most common complication of shingles is postherpetic neuralgia. Latency is in dorsal root or trigeminal ganglia. Involvement of the V1 branch of the trigeminal nerve can cause herpes zoster. Ophthalmicus. Epstein-Barr virus, also called human herpes virus 4, or HHV-4, the route of transmission is respiratory secretions and saliva. Often called the kissing disease, common among teenagers and young adults. Teenagers kisses each other right, causes infectious mononucleosis. Symptoms include fever, hepatosplenomegaly, pharyngitis, and posterior cervical lymphadenopathy. Notes: associated with lymphomas like endemic Burkitt lymphoma, nasopharyngeal carcinoma, especially in Asian adults, and lymphoproliferative diseases in transplant patients. Also infects B cells through CD21. Think of the phrase, "You must be 21, to drink beer in a bar." Atypical lymphocytes seen on blood smear are reactive cytotoxic T cells, not infected B cells. Positive monospot test shows heterophile antibodies. Just know that, using amoxicillin in these patients can cause a maculopapular rash. Are you with me? Cytomegalovirus, also known as human herpes virus 5, or HHV-5, the route of transmission is congenital, transfusion, sexual contact, saliva, urine, and transplant. In healthy individuals, CMV causes mononucleosis with a negative monospot test. In immunocompromised patients, causes pneumonia, esophagitis, colitis, and retinitis, often called cytomegalovirus. Because of its effect on vision, note that infected cells show characteristic owl eye, intranuclear inclusions. The virus is latent in mononuclear cells. Human herpes virus 6 and 7, HHV-6 and HHV-7, the route of transmission is saliva, causes Roseola infantum, also called exanthem subitum, characterized by high fevers for several days, which can lead to seizures, followed by a diffuse macular rash starting on the trunk and spreading to the extremities. Note that, typically seen in children under 2 years old. Remember, fever first, rosy rash later. HHV-7 is a less common cause of roseola. Human herpes virus 8, HHV-8, the route of transmission is sexual contact. Clinical significance, causes Kaposi sarcoma, a neoplasm of endothelial cells, common in HIV and AIDS patients, as well as transplant recipients. Note that, presents as dark or violaceous plaques or nodules caused by vascular proliferation, can also involve the gastrointestinal tract and lungs. I want to tell you, if you are following me, you are doing great. Herpes simplex virus identification, by polymerase chain reaction, abbreviated as PCR, of skin lesions is the test of choice. Cerebrospinal fluid, CSF PCR is used for diagnosing herpes encephalitis. The Zank test, which is now outdated, involves smearing an open skin vesicle to detect multinucleated giant cells. These are commonly seen in infections with herpes simplex virus type 1, type 2, and varicella zoster virus. In addition, intranuclear eosinophilic inclusions, known as Cowdrey type A inclusions, are seen with herpes simplex virus types 1 and 2, and varicella zoster virus. Receptors used by different viruses. Cytomegalovirus, or CMV, uses integrins, and heparin sulfate as receptors. Epstein-Barr virus, or EBV, uses the CD21 receptor. Human immunodeficiency virus, or HIV, uses the CD4 receptor along with CXCR4 and CCR5 coreceptors. Parvovirus B19 uses the P antigen on red blood cells. Rabies virus binds to the nicotinic acetylcholine receptor. Rhinovirus binds to the ICAM1 receptor. You can remember this with the phrase, "I came to see the rhino." SARS coronavirus 2, or SARS-CoV-2, uses the ACE2 receptor.
RNA viruses overview. Here is some quick definitions of terms. Single-stranded means one strand of RNA, double-stranded means two strands of RNA, positive sense means the RNA can be directly translated into protein, negative sense means it must first be copied into a positive strand before translation. Arbovirus means the virus is transmitted by arthropods like mosquitoes or ticks. All RNA viruses replicate in the cytoplasm, except for retroviruses and influenza viruses. A helpful memory aid, retroflu is out of sight, meaning, they replicate outside the cytoplasm. Reoviruses have no envelope, are double-stranded linear RNA, which is multi-segmented. Remember from this group, rotavirus causes diarrhea in young children, which can be fatal. Picornaviruses, these perks have no envelope, with single-stranded positive-sense linear RNA. Some important virus from this family like poliovirus, causes polio. Salk and Sabin vaccines are used to prevent polio. Echovirus is another one, causes aseptic meningitis. Rhinovirus causes the common cold. Coxsackie virus causes different sort of illness, like aseptic meningitis, herpangina, mouth blisters with fever, hand, foot and mouth disease, myocarditis, and pericarditis. Hepatitis A virus obviously causes acute viral hepatitis. For your memory aid, use a mnemonic, PERCH, which stands for poliovirus, echovirus, rhinovirus, Coxsackie virus, hepatitis A virus. Hepavirus has no envelope, with single-stranded positive-sense linear RNA. One notable example is from this hepavirus is hepatitis E virus. Caliciviruses has no envelope, contains single-stranded positive-sense linear RNA. One known example from this family is norovirus, causes viral gastroenteritis. Flaviviruses, envelope is present, they came with single-stranded positive-sense linear RNA. Some medically important virus from this group includes hepatitis C virus, yellow fever virus, dengue virus, West Nile virus which causes meningoencephalitis and acute asymmetric flaccid paralysis, and others like Zika virus are also from this group. Oh shit, you got too much information, let's go with the rest. Toga viruses, these are enveloped with single-stranded positive-sense linear RNA. Examples of some virus from this lovely family are chikungunya virus, rubella, was formerly classified as a toga virus, eastern and western equine encephalitis viruses. Quick memory aid for your forgetful brain, toga crew, which stands for chikungunya, rubella, eastern, and western equine encephalitis. Matonaviruses, these are yet another enveloped virus, with single-stranded positive-sense linear RNA, example, rubella virus. Retroviruses, envelope is present, single-stranded positive-sense linear RNA, one high-yield information. These family have reverse transcriptase enzyme. Some famous virus like human T-cell leukemia virus, HTLV, and human immunodeficiency virus, HIV, which causes AIDS, are from this family. Coronaviruses, envelope present, single-stranded positive-sense linear RNA, medical importance, known as a cause of common cold, severe acute respiratory syndrome, SARS, Middle East respiratory syndrome, MERS, and COVID-19, are from this group as you might have guessed. Orthomyxoviruses, envelope present, single-stranded negative-sense linear RNA, multi-segmented, example from this group yet another famous virus, influenza virus. Paramyxoviruses, envelope is present, came with single-stranded negative-sense linear RNA, medically important virus for this family. Parainfluenza virus, causes croup, respiratory syncytial virus, RSV, causes bronchiolitis in babies. Measles virus, mumps virus, are yet other examples from this group. Pneumoviruses, envelope present, single-stranded negative-sense linear RNA, examples RSV, causes bronchiolitis in babies. Rhabdoviruses, envelope is present, single-stranded negative-sense linear RNA, example, rabies virus. Filoviruses, enveloped, single-stranded negative-sense linear RNA, example, Ebola virus disease, Marburg virus disease, both are often fatal, yeah they can kill you easily. Arenaviruses, envelope present, single-stranded RNA, both positive and negative sense, which is circular and multi-segmented, that is mind-blowing, isn't it? From this group viruses include, lymphocytic choriomeningitis virus, LCMV, Lassa fever encephalitis, spread by rodents. Bunyaviruses, envelope present, single-stranded negative-sense circular RNA, multi-segmented, examples, California encephalitis virus, sandfly and Rift Valley fever viruses, Crimean Congo hemorrhagic fever virus, hantavirus, causes hemorrhagic fever and pneumonia. Delta virus, envelope present, single-stranded negative-sense circular RNA, examples, hepatitis D virus, HDV, it is defective and requires hepatitis B virus, HBV, to replicate. To summarize Rio, Bicorna, Heap, calciviruses are non-enveloped, others are enveloped, and don't forget only Riovirus is double-stranded, others single-stranded. Congratulations, you just finished quick revision of RNA viruses. Let's dive deep into some RNA virus. Picornaviruses include poliovirus, echovirus, rhinovirus, coxsackie and hepatitis A virus. These viruses are RNA viruses. When they enter the body, their RNA is translated into one large protein. This large protein is then cut by enzymes made by the virus into smaller, functional viral proteins. Poliovirus, echovirus, and coxsackie belong to a group called enteroviruses. They can cause a condition known as aseptic meningitis, which is a type of viral meningitis. You can remember picornaviruses by thinking of the phrase, perch on a peak. Perch stands for poliovirus, echovirus, rhinovirus, coxsackie and hepatitis A. And pico means small, these are small RNA viruses. Rhinovirus is also a picornavirus. It is a non-enveloped RNA virus and is the main cause of the common cold. There are over 100 different types of rhinovirus. It is acid-labile, which means it is destroyed by stomach acid. So, unlike the other picornaviruses, it does not infect the gastrointestinal tract. Think of it this way, rhino has a runny nose. Now, let's talk about rotavirus. Rotavirus is a double-stranded RNA virus with multiple segments. It belongs to a family of viruses called reoviruses. Rotavirus is the leading cause of gastroenteritis in infants around the world. In the United States, it is a major cause of diarrhea in children during the winter months, especially in places like day-care centers and kindergartens. Rotavirus damages the small intestine. It destroys the villi, which are tiny finger-like structures that absorb nutrients. This damage causes poor absorption of sodium and loss of potassium, leading to diarrhea. A way to remember rotavirus is, write out the anus. The Centers for Disease Control and Prevention, or CDC, recommends that all infants receive the rotavirus vaccine. However, babies with a history of intussusception, a rare condition where part of the intestine slides into another part, or those with severe combined immunodeficiency, also called SCID, should not receive the vaccine.
Influenza viruses belong to a family called orthomyxoviruses. These are enveloped viruses with negative sense, single-stranded RNA. Their genome is segmented, meaning it comes in separate pieces. Influenza viruses have two important surface proteins. These are hemagglutinin, which helps the virus bind to cells and get inside, and neuraminidase, which helps new virus particles leave the infected cell. An easy way to remember this: hemagglutinin lets the virus in, neuraminidase sends the virus away. People with the flu are at risk for a serious complication called a bacterial superinfection. The most common bacteria that cause this are Staphylococcus aureus, Streptococcus pneumoniae, and Haemophilus influenza. Treatment for influenza includes rest, fluids, and sometimes medicines called neuraminidase inhibitors, such as oseltamivir and zanamivir. The flu vaccine changes every year because the virus itself changes rapidly. This vaccine includes the strains most likely to circulate during the flu season. There are two main types of flu vaccines. These are the killed vaccine, which is most commonly used, and the live attenuated vaccine, which contains a weakened virus that grows in the nose but not in the lungs, and it is given through the nose. Now let's talk about how influenza changes over time. Antigenic shift is a sudden and major change. It happens when two different flu viruses infect the same cell. They can exchange RNA segments, creating a completely new virus. This can lead to pandemics, large, global outbreaks. Antigenic drift is a gradual change. It results from small mutations in the genes for hemagglutinin or neuraminidase. These small changes cause local or seasonal outbreaks called epidemics. A good way to remember it: shift is sudden and severe, while drift is gradual. Rubella virus is a type of metapneumovirus. It causes rubella, also known as German measles or three-day measles. In children, rubella usually causes a mild illness with fever, swollen lymph nodes behind the ears, joint pain, a fine pink rash that starts on the face and spreads to the body and arms. Rubella is more dangerous during pregnancy. It is part of the torch group of infections, which are infections that can harm the unborn baby. If a baby is infected with rubella before birth, it may have a classic triad of symptoms. These are deafness, cataracts, which are cloudy eyes, patent ductus arteriosus, a heart defect. Sometimes these babies have a bluish skin appearance called a blueberry muffin rash caused by abnormal blood cell formation in the skin. Paramyxoviruses are a family of viruses that mostly affect children. This group includes the viruses that cause parainfluenza, which causes croup, mumps, measles, respiratory syncytial virus, or RSV, human metapneumovirus. All of these viruses can cause breathing problems in infants, such as bronchiolitis and pneumonia. They all have a protein called the F protein, or fusion protein. This protein makes infected cells stick together and form large, multinucleated cells. To help protect premature babies from RSV, a special antibody called palivizumab is used. It blocks the F protein and prevents RSV from causing pneumonia. Helpful phrase to remember this is palivizumab for paramyxovirus protection in preemies. Croup, also known as acute laryngotracheobronchitis, is caused by parainfluenza viruses. These viruses have two important proteins on their surface: hemagglutinin, which helps the virus enter the body's cells; neuraminidase, which helps the virus spread by releasing new virus particles. Croup leads to a characteristic seal-like barking cough and inspiratory stridor, which is a harsh sound when the child breathes in. On a neck X-ray, doctors often see a narrowing of the upper airway called the steeple sign, which is typical of this condition. Measles, also called rubeola, starts with a prodrome, or early set of symptoms. These include fever, cough, coryza, which is a runny nose, conjunctivitis, or red, irritated eyes. After a few days, small white spots with a red background appear inside the mouth. These are called Koplik spots and are found on the inner cheek. 1 to 2 days later, a red maculopapular rash appears. It starts on the head and neck and then spreads down to the rest of the body. In the lymph nodes, a special type of fused cell called a Warthin-Finkelty giant cell may be seen. These appear alongside increased immune activity in the lymph tissue. Possible complications of measles include subacute sclerosing panencephalitis, or SSP, which can occur years after the initial infection. It causes changes in personality, memory loss, problems with body control, and eventually death. Encephalitis, or brain inflammation, which may develop a few days after the rash appears. Giant cell pneumonia, which is rare and usually happens in people with weakened immune systems. To help remember the early signs of measles, think of the 4 C's. Cough, coryza, conjunctivitis. C for Koplik spots. Vitamin A is recommended for children with measles, especially if they are malnourished. It can reduce the chance of complications and death. The most common cause of death from measles in children is pneumonia. Mumps virus is now rare because of the success of the MMR vaccine, which protects against measles, mumps, and rubella. When mumps does happen, it causes parotitis, which is swelling of the salivary glands near the ears, orchitis, or inflammation of the testicles, aseptic meningitis, a viral inflammation of the brain and spinal cord, and sometimes pancreatitis, which is inflammation of the pancreas. Mumps can cause sterility, especially in males who get the infection after puberty. A fun way to remember the symptoms of mumps is this. Mumps makes your parotid glands and testes as big as pom poms. POM stands for P for parotitis, O for orchitis, M for meningitis. And don't forget pancreatitis too.
Arboviruses transmitted by Aedes mosquitoes include chikungunya virus, dengue virus, yellow fever virus, and Zika virus. Let's break them down. Chikungunya virus, it's an alpha virus, part of the togavirus family, spread by Aedes mosquitoes. Symptoms include high fever, maculopapular rash, headache, swollen lymph nodes, and inflammatory joint pain or polyarthritis. Joint pain and swelling are common and especially specific for chikungunya. Blood changes like low platelet count and bleeding are less common compared to dengue. Diagnosed with RT-PCR or serologic testing, treatment is supportive, but long-term joint pain may require steroids or disease-modifying drugs. Prevention involves avoiding mosquito bites. No vaccine is currently available. Dengue virus, it's a flavivirus, also spread by Aedes mosquitoes. Dengue fever presents with fever, rash, headache, muscle and joint pain, pain behind the eyes, called retroorbital pain, low white blood cell count. Dengue hemorrhagic fever includes all the above symptoms, plus bleeding, fluid leakage, very low platelet counts, blood vessel damage. A second infection with a different dengue strain increases risk for severe disease due to something called antibody-dependent enhancement. This can lead to dengue shock syndrome, where fluid leaks cause dangerous circulatory collapse. Diagnosed with RT-PCR or serology, treatment is supportive. In severe cases, patients may need 4 fluids or blood transfusions. Prevention includes mosquito control and bite protection. A live recombinant vaccine is available in some areas. It is made using a yellow fever virus base and dengue virus proteins. Yellow fever virus, a flavivirus and arbovirus, also spread by Aedes mosquitoes. The virus lives in monkeys or humans. Flavi means yellow. This refers to jaundice. One of the symptoms yellow fever include high fever, black vomit, jaundice, bleeding, back pain. Liver biopsy may show councilman bodies, which are dying liver cells. A live, attenuated vaccine is recommended for travelers going to countries where yellow fever is common. Zika virus, also a flavivirus, usually spread by Aedes mosquitoes. Most people have mild illness or no symptoms. About 20% get red eyes, conjunctivitis, mild fever, itchy rash. Zika outbreaks are more common in tropical and subtropical areas, can cause Guillain-Barré syndrome, a nerve condition. Diagnosed with RT-PCR or serology. Treatment is supportive care only, no specific treatment. Zika can spread through sex and from mother to baby. During pregnancy, it can cause congenital Zika syndrome, which includes microcephaly, or a small head, eye problems, movement disorders, like spasticity or seizures. Brain imaging may show ventriculomegaly and calcifications in the brain. Rabies virus, this killer is a bullet-shaped virus. There is a thing called Negri bodies, which are cytoplasmic inclusions, are commonly found in infected Purkinje cells of the cerebellum and hippocampal neurons. This rabies virus has a long incubation period, usually lasting weeks to months before symptoms appear. Post-exposure prophylaxis includes wound cleaning, immunization with a killed vaccine, and rabies immunoglobulin provision. This is an example of passive active immunity. Rabies travels to the central nervous system by moving retrograde along nerve axons using dynein motors, after binding to acetylcholine receptors. Disease progression starts with fever and malaise, followed by agitation, photophobia, hydrophobia, and hypersalivation, then finally leads to paralysis, coma, and finally death. In the United States, rabies is more commonly transmitted by bats, raccoons, and skunks than by dogs. Aerosol transmission, for example in bat caves, is also possible. Ebola virus. This nasty virus is family of filovirus. After an incubation period of up to 21 days, symptoms begin abruptly with flu-like symptoms, vomiting and diarrhea, high fever and muscle pain. Then the disease can progress to disseminated intravascular coagulation, DIC, widespread bleeding, and shock. Diagnosed with recombinant PCR, especially within 48 hours of symptom onset, this Ebola virus has a high fucking mortality rate. Transmission requires direct contact with bodily fluids, like contaminated surfaces, fomites, or infected bats and primates. Be careful, there is a high risk of infection in healthcare settings. Prevention includes supportive care, no definitive cure, vaccination of contacts, strict isolation, and barrier precautions for healthcare workers. SARS-CoV-2, COVID-19. SARS-CoV-2 is a positive-sense single-stranded RNA virus. It causes COVID-19 and spreads through respiratory droplets, aerosols, and fomites. Symptoms vary and may include fever, muscle aches, headache, nasal congestion, sneezing, cough, sore throat, nausea, diarrhea, loss of smell, anosmia, and loss of taste, dysgeusia. Severe cases can cause pneumonia, blood clots like deep vein thrombosis and pulmonary embolism, stroke, heart damage, and organ failure. Diagnosis is done using RT-PCR, nucleic acid amplification test, rapid antigen test, which is quicker but less sensitive. The virus enters cells by binding its spike protein to the ACE2 receptor, which is found in the lungs, intestines, heart, and kidneys. Vaccines, like mRNA and viral vector vaccines, work by introducing the spike protein, prompting the immune system to make antibodies against.
Overview of hepatitis viruses, HAV, HBV, HCV, HDV, HEV. Common signs and symptoms. All hepatitis viruses can cause fever, jaundice, and elevated liver enzymes, like ALT and AST. Note, the naked viruses, which are HAV and HEV, lack an envelope. That means they are not destroyed by the gut. Just remember, the vowels hit your bowels. A and E cause fecal-oral infections. Virus-specific details. Hepatitis A virus, HAV, is under the family of RNA picornavirus. The fucking mode of transmission of this virus is fecal-oral. Think shellfish, daycare, and travelers. It has short incubation period, lasting only few weeks. The clinical course is acute and self-limited in adults, and often asymptomatic in children. This infection generally has good prognosis with no cancer risk like HCC. Some liver biopsy findings in this infection includes hepatocyte swelling, monocyte infiltration, Councilman bodies. There is no carrier state for hepatitis A virus infection. Hepatitis B virus, HBV, is under the family of the DNA hepatinovirus, transmitted via blood, parenteral, sex, bedroom, and birth, perinatal. It has long-ass incubation period spanning several months. The clinical features of this infection starts like serum sickness, to result fever, joint pain, and rash, and may progress to liver cancer. The prognosis, in adults often recover fully, but newborns have a worse outcome. Liver biopsy findings includes granular eosinophilic ground glass appearance from viral surface antigen and damage caused by cytotoxic T cells. Definitely carrier state is common. Unique note: HBV uses a DNA polymerase with both DNA and RNA-dependent activity. It completes the partially double-stranded DNA in the nucleus, then reverse transcribes viral RNA into DNA for new viruses. Hepatitis C virus, HCV, belongs to family of RNA flavivirus. Transmission is mainly via blood-like, injection drug use, and past transfusions. The incubation period is long, and often progresses to cirrhosis or cancer. The prognosis is, most patients develop chronic hepatitis. The liver biopsy findings in this infection includes lymphoid aggregates and focal macrovesicular steatosis. Usually carrier state is very common. Unique note: HCV lacks proofreading, number 3' to 5 exonuclease, causing frequent mutations. This leads to antigenic variation, so antibodies struggle to keep up. Are you following me? Hepatitis D virus, HDV, these motherfuckers included in the family of RNA delta virus. The transmission is via blood, sexual, and perinatal. The incubation period is, if superinfection, after HBV, it is short. If it is co-infection, with HBV, it is long. Clinical course is similar to HBV, but often more severe. The prognosis also, if it is superinfection, leads to worse outcomes. Obviously, has cancer risk, that is HCC. The liver biopsy finding in this infection usually is similar to HBV. The carrier state depends on HBV. Unique note: HDV is a defective virus. It requires HBV surface antigen to enter liver cells. Hepatitis E virus, HEV, belongs to family of RNA hepavirus. The transmission is via fecal-oral, especially waterborne. The incubation period is short. The clinical feature often leads to severe hepatitis in pregnant women. Prognosis, as mentioned, has high mortality in pregnancy, has no cancer risk like HCC. In liver biopsy it shows patchy necrosis, like hepatitis A virus, have no carrier state. Extrahepatic manifestations of hepatitis B and C. The hematologic, blood-related, manifestation of hepatitis B virus includes aplastic anemia, while hepatitis C can cause essential mixed cryoglobulinemia, and increased risk of B-cell non-Hodgkin lymphoma, also idiopathic thrombocytopenic purpura, ITP, and autoimmune hemolytic anemia. Renal, kidney-related manifestation of hepatitis B, most commonly causes membranous glomerulonephritis, and less commonly causes membranoproliferative glomerulonephritis. While hepatitis C more commonly causes membranoproliferative glomerulonephritis, and less commonly causes membranous glomerulonephritis. Vascular or blood vessel-related conditions related to hepatitis B include polyarteritis nodosa. While hepatitis C is associated with leukocytoclastic vasculitis. Dermatologic, skin-related, manifestations for hepatitis C includes sporadic porphyria cutanea tarda, and lichen planus, to list some. Endocrine and hormone-related, manifestation of hepatitis C includes the increases risk of diabetes mellitus, and autoimmune hypothyroidism. Hepatitis serologic markers. Hepatitis A markers, anti-HAV IgM antibody to hepatitis A virus. It is the best test for detecting acute hepatitis A. Anti-HAV IgG, it is IgG antibody, indicates prior infection or vaccination, provides protection against reinfection. Hepatitis B markers, HBsAg, hepatitis B surface antigen, and it indicates current infection. Anti-HBs, antibody to the surface antigen, and it indicates immunity due to vaccination or recovery. HBsAg, core antigen of hepatitis B, not typically measured in blood. Anti-HBc, it is antibody to the core antigen. IgM means recent or acute infection, IgG means past exposure or chronic infection. During the window period, IgM anti-HBc may be the only positive marker. HBAg, secreted by infected liver cells, it indicates active viral replication and high infectivity. It is not part of the mature virus particle. Anti-HB, antibody to HBe antigen, indicates lower infectivity. Hepatitis B serologic marker patterns by stage. 1. In incubation period, hepatitis B surface antigen is positive, all other markers are negative. 2. In acute infection, hepatitis B surface antigen and IgM antibody to core antigen is positive, also hepatitis B, E antigen is positive. 3. Window period, the IgM antibody to core antigen is positive, also antibody to hepatitis B, E antigen is positive, but all others are negative. Note that this is the tricky phase where only core IgM antibody to hepatitis B, E antigen may be detected. 4. Recovery, antibody to hepatitis surface antigen, is positive, and IgG antibody to hepatitis core protein is positive. Lastly, antibody to hepatitis B, E antigen is also positive. 5. Chronic infection, with high infectivity, hepatitis B surface antigen is positive, and IgG antibody to hepatitis B core protein is positive. Lastly, hepatitis B, E antigen is positive. 6. Chronic infection, with low infectivity, hepatitis B surface antigen is positive, and IgG antibody to hepatitis B core protein is positive. Lastly, antibody to hepatitis B, E antigen is positive. 7. Immunized, vaccinated, in this situation, only antibody to hepatitis surface antigen is positive, but all others are negative. Note that no core antibody is present because there was no infection, only vaccination. HIV overview. HIV, or human immunodeficiency virus, has several key components. These are envelope proteins, which are acquired by budding from the host cell's plasma membrane. These include GP120, a docking glycoprotein that helps the virus attach to CD4 plus T cells, GP41, a transmembrane glycoprotein responsible for viral fusion and entry. Capsid protein, which is P24, that is important for forming the core of the virus and used in diagnostic testing. The other structure is matrix protein, like P17, provides structural support inside the envelope, and lipid envelope, which comes from the host cell membrane. This virus has diploid RNA genome, which means HIV carries 2 RNA molecules. There are 3 structural genes with different functions. These are ENV gene, which produces GP160, which is cleaved to form GP120 and GP41, and GP120 binds to CD4 plus T cells, while GP41 facilitates fusion and entry. The GAG gene, known to produces P24, capsid protein, and P17, matrix protein. The last gene is POL gene, think RIP POL, which codes for reverse transcriptase, integrase, and protease. Remember that reverse transcriptase converts RNA into double-stranded DNA. This DNA is then integrated into the host genome. HIV cell entry starts with HIV binds to CD4 receptors on T cells. It also requires co-receptors, like CCR5 on macrophages during early infection, and CXCR4 on T cells during late infection. People with homozygous CCR5 mutations are immune to HIV, while heterozygous CCR5 mutations lead to slower disease progression. HIV diagnosis. Initial testing involves HIV-1 and 2 antigen-antibody combination test, which detects P24 antigen, and IgG and IgM antibodies to HIV-1 and HIV-2. These testes are highly sensitive and specific, but may miss infection if done within the first 2 weeks. The confirmatory testing is done if the combination test is positive. Follow up with an HIV-1 and HIV-2 differentiation immunoassay. Nucleic acid testing, NAT, is used if results are indeterminate. HIV-1 NAT detects viral RNA in the blood. Qualitative NAT is used to detect early infection. Quantitative RT-PCR measures viral load, which is used to monitor treatment effectiveness and transmissibility. Note that the Western blot test is no longer recommended by the CDC. Special cases, for infants born to HIV-positive mothers, do not use antibody tests. Due to maternal antibodies, use HIV viral load testing instead. AIDS diagnosis. AIDS is diagnosed when CD4 plus count is less than or equal to 200 cells per mm superscript 3, or the person has an AIDS-defining condition, such as pneumocystis pneumonia. Common diseases in HIV-positive adults. As CD4+ cell count decreases, the risk of opportunistic infections increases. This includes reactivation of infections like tuberculosis, herpes simplex virus, and shingles, dissemination of bacterial and fungal infections, increased risk of non-Hodgkin lymphomas. When CD4+ count is less than 500 cells, it may present with Candida albicans infection, which causes oral thrush, present as white plaque in the mouth that can be scraped off. Upon microscopy, it shows pseudohyphae. Epstein-Barr virus, EBV, causes oral hairy leukoplakia, which causes white plaque on the side of the tongue that cannot be scraped off. Human herpes virus 8, HHV-8, causes Kaposi sarcoma, present with red or purple skin lesions. On histology it shows spindle cells and vascular tumors. Human papillomavirus, HPV, can cause squamous cell carcinoma. Common sites are anus, cervix, oropharynx. Mycobacterium tuberculosis, risk of reactivation of latent TB. When CD4+ count is less than 200 cells. Common infections include Histoplasma capsulatum, which causes systemic fungal infection. Symptoms are fever, weight loss, cough, shortness of breath, nausea, vomiting, and diarrhea, and upon microscopy it shows oval yeast cells inside macrophages. HIV itself can also cause dementia. HIV-associated nephropathy. Neuroimaging may show cerebral atrophy. JC virus reactivation causes progressive multifocal leukoencephalopathy. On MRI, it shows non-enhancing areas of demyelination. Kaposi sarcoma may spread to lungs, GI tract, and lymph nodes. Pneumocystis jirovecii causes pneumocystis pneumonia, PCP. In this case, imaging shows ground glass opacities on chest scans. When CD4+ count is less than 100 cell, Bartonella species start to cause bacillary angiomatosis, which are multiple red or purple skin lesions. The biopsy shows neutrophilic inflammation. Candida albicans start to cause esophagitis. On endoscopy it shows white plaques. On biopsy it shows yeast with pseudohyphae. Cytomegalovirus, CMV, can cause colitis, retinitis, esophagitis, encephalitis, and pneumonitis. On endoscopy, it shows linear ulcers, and on fundoscopy, cotton wool spots may be seen. Biopsy will show cells with alveoli inclusions. Cryptococcus neoformans causes meningitis. On microscopy it shows encapsulated yeast on India ink stain or positive antigen test. Cryptosporidium causes chronic watery diarrhea. On stool test it shows acid-fast oocysts. Epstein-Barr virus, EBV, can cause B-cell lymphoma, such as CNS lymphoma. On imaging, ring-enhancing lesions, often solitary, will be revealed. Mycobacterium avium complex, MAC, includes M. avium intracellular. The symptoms are fever, night sweats, weight loss, diarrhea, and lymphadenitis. Most common conditions when CD4+ count is under 50 cells are Toxoplasma gondii, causes brain abscesses. MRI shows multiple ring-enhancing lesions. Prion and prion diseases. Prion diseases are caused by the misfolding of a normal protein, called PRPC, and it has mostly alpha helical structure. The disease-causing form is called a little microscopic bastard PRPSC protein, which has a beta-pleated sheet structure. These prion causes disease. When PRPSC protein convert normal PRPC protein into more abnormal PRPSC protein, then this PRPSC is resistant to protease degradation, meaning it can't be broken down easily by enzymes. It accumulates in the fucking brain, leading to damage. Transmission. Prion are transmissible through CNS-related tissues, like iatrogenic Creutzfeldt-Jakob disease, CJD, can occur through medical procedures. Variant CJD can be contracted by consuming beef infected with mad cow disease, or BSE. When you try to sterilize, prion are resistant to standard sterilization, including standard autoclaving procedures. The clinical effects of prion diseases is spongiform encephalopathy, which is when the brain develops sponge-like holes. Symptoms include dementia, ataxia, or loss of coordination. startle myoclonus, which is sudden jerking in response to noise or touch, rapid progression to death. Examples of prion diseases: 1. Creutzfeldt-Jakob disease, CJD, which is rapidly progressive dementia, usually sporadic, but some forms are familial, bovine spongiform encephalopathy, BSE, also known as mad cow disease, which is linked to consumption of infected beef. Kuru, which is a historical prion disease, found in tribal populations who practiced ritual human